All right, folks, we are joined now by Scott Trenti. He is the CEO of SeniorCare here in Gloucester. Of course, you've heard about their Senior Meals on Wheels program, and they do so much more. So thanks for joining us, Scott.
Thank you.
And for those who don't know, can you give a little refresher on what SeniorCare is all about?
Okay, so SeniorCare is a state-designated aging service access point, otherwise known as a ASAP. And through the state ASAP system, we provide home care services to folks that are 60 and above, as well as a number of other services like protective services, caregiver support, money management. We're also a federally designated area agency on aging. So I have 25 colleagues throughout Massachusetts. We're all nonprofits. We all have different names, but we all contract with the state to implement the state home care program. As an area agency on aging, we also are responsible for nutrition services, which is something that I really want to talk about today. In particular, our Meals on Wheels program, where we're serving over 550 people per day. Our catchment area includes the 4 communities of Cape Ann, as well as Hamilton, Wenham, Ipswich, Topsfield, and Beverly. So those are the 9 communities that we're responsible for.
That is, you're doing such important work, and particularly at this critical time, Scott. So tell us what the new challenges are for this major effort.
Well, I think that, as a result of the virus, we've had to make a number of statewide changes, and certainly here at SeniorCare. So we work closely with the Executive Office of Elder Affairs, and they've been very, very supportive. And we have a great partnership between EOEA and our Mass Home Care Network. Pretty much right now, everybody at SeniorCare, with the exception of a few people, are in the office at a time. Most of our work is being conducted telephonically. So our care managers and our nurses, and unless it's a serious emergency, our protective service staff, caregiver support staff, and all the other folks, our ombudsman program for our 7 nursing homes. But all the staff are working remotely and conducting their business telephonically. So that's been the biggest change.
Oh, okay. But how about delivering 550 meals safely, keeping your drivers protected and keeping this elderly population protected?
Exactly. So before I say that, I do want to emphasize that SeniorCare is open for new home care intakes. So if folks are needing in-home care, they can call us at our regular line, and someone will get back to them and conduct an intake if they need in-home services. So back to Meals on Wheels, right? This is more than ever, it's a critically important service. Given the fact that folks are staying home. So yes, meals are continuing in our 9 communities. There have recently been some rumors that have been sort of site-specific that Meals on Wheels would shut down. That's not the case. So I really want to emphasize that to the public. Over the past 3 weeks, we've been providing our Meals on Wheels recipients with frozen meals as well as shelf staple meals in the event that there is service disruption, which we do not anticipate at this time. So folks have that. We've also called, I would say, at least 95% of our nutrition clients, home delivered meals clients. Some people are having difficulty getting in touch with. We've also this week started utilizing robocalls for our recipients. So they receive a robocall yesterday as well as today.
Keep them updated on making sure they know they're confident their meals are coming and the procedure for delivering them. Is that the sort of information you're telling them about?
Yes, and I'll get, for example, yesterday we let our clients know that we would be delivering 2 meals to cover yesterday and today, and that we wouldn't be delivering today, utilizing that to sort of provide our drivers with a rest as well as to kind of regroup. We've made a change in our delivery system. So typically a driver would drop the meal off, might go into the home. What we're doing right now, and recognizing the importance of social distancing, is that they're dropping the meal off on the doorknob, knocking or ringing the bell, backing off, and making sure that they have either verbal contact with the elder, or if the elder opens the door, that well-being check can be conducted, because just as important as the meal is that wellness check, which is inherent with the Meals on Wheels program. So we don't want to lose that, but we also want to ensure the safety of the elder as well as our driver. If there are special circumstances whereby an elder can't get to the door, maybe there's some mobility issues or something like that, then we're making special arrangements with them. So,
excuse me, Scott, are your drivers using protective equipment when they're delivering the meals? And if they are, I assume it's expensive. Hard to
they
get.
are, and just like everybody else, the shortage of personal protection equipment, otherwise known as PPE, is limited. Everybody, I think, is scrambling to try to get PPE, but at this time they are utilizing gloves and masks.
And you're not having a hard time finding enough equipment?
We're okay for now.
Okay.
We certainly are going to need more. We've ordered more. Some communities have helped us out with, donations and so forth. But, it's certainly a need. Another big need that we have is hand sanitizer. So, when a driver will wear gloves and deliver that meal, sometimes they need to switch out those gloves. So we're doing the best that we can at this point, but we will, just like everyone else, need PPE without a doubt.
Well, luckily, Scott, Ryan and Wood Distillery is right around the corner from you.
Ryan and Will Distillery, I want to give them a shout out because they did provide us with some hand sanitizer. What we're finding is that people are really stepping up. Our volunteer, we have the Retired Senior Volunteer Program, otherwise known as RSVP, and we've seen a pretty nice uptick in the number of people calling to be volunteers. Now, that takes a little bit of time to process. They have to be trained. We have to run a motor vehicle check and a query. But we're really going to be counting on them for driving in particular, and to make sure that we have a sufficient group of volunteers that can deliver those meals for us.
Well, is there any other way that the public can be helping SeniorCare in the meantime?
I think to stay tuned, I would say do what the governor says in terms of minimizing time out of the home, particularly if you're an elder or an elder with a pre-existing medical condition or conditions. I think that's really important. I would say for those folks that are on Facebook and on the internet, monitor our website, our Facebook page. If you're on Twitter, the Massachusetts Department of Public Health is something that the public should, take a look at, even, on an intermittent basis, optimally on a daily basis. I would say to be patient and take care of each other. We're seeing a lot, not only with volunteers, but a lot of other group activities, not group activities with social distancing, but just to support each other and stay in touch with each other. And, we've been concerned about folks that are socially isolated and lonely even before this crisis hit. And now more than ever, given the fact that people are staying home, that's a concern of ours. We're doing frequent wellness calls to people. Our case management department, which includes nurses and care managers, are calling all of our clients. We started this 2 weeks ago, and we characterize our clients by risk level, and with 1 and 2 being the highest risk consumers. So our care managers have reached out to them and they're making great progress with, calling everyone. Those folks that are high nutrition risk and high risk that are in our home care program, we're prioritizing them for an increased frequency of contact, especially given that our care managers and our nurses are working from home and they're conducting their work telephonically. So they're not traveling and eating up valuable time, so they're able to call our consumers on a more frequent basis. But things like people in the home care program, if they're due for a reassessment or an annual redetermination or something like that, it's business as usual. It's just not being done in person. It's being done telephonically.
Right.
Well, we appreciate everything you're doing, you and the folks at SeniorCare, and hopefully Heather and I can touch base with you sometime soon and see how things are progressing and how else we can help.
That would be great. If I could just give a shout out to our drivers and our volunteers and our nutrition site coordinators and our provider network. So for those homemakers, personal care workers, home health aides, and others, companion chore workers, they're going to the homes. They're continuing to implement care plans and helping people in the home. And they deserve a lot of credit. And these folks are in addition to the people that I just mentioned, are the real heroes in this. Well, so, yeah, I thank you for giving me this opportunity. And if you wanted a weekly update or whatever you guys need or want, I'm more than willing.
We'd love that. We'll be in touch.
All right. Everybody be safe.
Be well.
Thank you. Bye-bye.
Bye.